Okay, the histology of the lung. So we have the macroscopic anatomy. I'll start with the macroscopic anatomy, but focusing mostly on histology. The airways, we have the trachea bifurcating to the right and left main bronchi, which go along and give rise to the lobar bronchi corresponding to 3 lobes on the right side and 2 lobes on the left side. And the lobar bronchi each gives on the right side about 3 segmental bronchi, and on the left side about 4 to 5 segmental bronchi. Bronchioles are basically less than 1 millimeter in comparison to the bronchi, which are more than 1 centimeter in diameter. Okay, terminal bronchioles are smaller. Okay. For just the purpose of remembering, we have a very important structure, parenchymal structure, called the bronchopulmonary segment. And each bronchopulmonary segment corresponds to a very central segmental bronchiole, segmental bronchi, okay, segmental bronchus, with its divisions, which are all of the bronchioles. Okay, so each of those segments is basically a parenchymal unit. Okay, we have a lobule, which is basically each terminal branch, and an acinus, which is basically each respiratory branch. So acini make lobules, and alveolar ducts basically make the acini. Okay, so alveolar ducts giving rise to the sacs, which have the alveoli. Very small picture here, but it just helps. With the lungs, as I said, we have 3 lobes. We have one special fissure, the horizontal fissure on the right side, and oblique fissures on both sides, the lingula, the cardiac notch for the heart on the left side. And those bronchopulmonary segments are very important to remember because they are histologically separated by an interlobular septa. Okay. Vasculature is very rough in here, difficult to remember. So on the right hilum, it's a little bit different than the left hilum. The right hilum has this epiarterial bronchus and hyperarterial bronchus because they're situated up and down in comparison to this pulmonary artery. Okay, but they are bronchi. They are basically the bifurcation of the main right bronchus, which bifurcates before the right lung. That's why it's higher than the left bronchus. Okay, superior pulmonary veins and inferior pulmonary veins are basically the same on the left side and on the right side, being on the lower area of the hilum. Okay. Microscopic anatomy. So this is the important part in here. We'll talk about the bronchi, the bronchioles. There is some correlation between them, then the alveoli and the interlobular septa. Okay, resuming back, so on histology, we'll talk about the bronchi, the difference between them and bronchioles, and then we'll talk about the deeper parts, which are the alveoli and the interlobular septa. The histology of bronchi. So for bronchi, the larger stuff, we have mucosa and submucosa. Okay, so for the mucosa, very basically, we have in the larger bronchi, we'll see ciliated pseudo-stratified columnar epithelium with goblet cells, respiratory epithelium in short. So basically, it has these small cilia that we can see, ciliated. Pseudo-stratified is because the cells have a projection up there, but they interlock with the other cells, looking like a stratified epithelium, but it's not stratified in real terms. Okay, columnar, because they look like rectangles basically, or you could say the 3D shape of a rectangle, which is columns, with goblet cells, as you can see here. There are the basal cells, which are the progenitors, and there is the basement membrane, which is a very important delineation and very important to remember with some conditions. The lamina propria in here, and under the lamina propria, sometimes we can say a smooth muscle layer based on where you are. Okay, in the submucosa, we have an area of seromucous glands, and it is going to be a elastic collagenous area. Okay, we have anteriorly C-shaped cartilaginous hyaline rings, so C-shaped rings of hyaline and cartilaginous areas composed of chondrocytes and the cartilage and perichondrium. If we really zoom in here, we can see the perichondrium and the chondrocytes in here, and this looks like a C shape. It's not complete, and it's only on the anterior side. Okay, this is in the trachea and in the main bronchus. The bronchioles, they have simple columnar or cuboidal epithelium, and it could be ciliated or not ciliated. Okay, mostly ciliated until the respiratory bronchioles, which have no cilia and have more of a cuboidal epithelium. Club cells are mostly going to be in the respiratory bronchioles and beyond that. Complete circular smooth muscle layer is going to be seen more in the bronchioles with no cartilaginous rings. Okay, so this, if we're talking about the bronchi, the lobar and the segmental bronchi, I think that this is pseudo-stratified. We still can see the cartilaginous ring. This is probably a bronchus, but importantly to remember, in the submucosa, we have cartilage, very good cartilage, and those mucinous seromucous cells. So it's a bit of serous and mucin to lubricate and help remove the gunk. Okay. Next, we have this lobar bronchi or bronchioles, whatever you want to call it. Probably a misnomer here. Anyway, there is this pulmonary artery, okay, and it's very important to remember larger arteries, and they are adjacent to these bronchioles, starting to become adjacent from the main bronchus, really, as you can see them in the hilum, and really help to invest the vasculature onto these alveoli, as you can see here. These are alveolar ducts and alveoli. We'll see more of them. Larger arteries, like this one, have lamina on the inner and outer side, which is an elastic lamina delineated here with the stain elastin. Okay, this is an elastin stain. Okay. So bronchioles, more of the bronchioles, what can we say? At the respiratory bronchioles, we have more of the club cells, which are going to secrete more of a serous, really lubricant rather than mucin, and we will not see the goblet cells, of course, because we are at the point of bronchioles. Diminished cilia will happen after the terminal bronchiole. The respiratory bronchioles will see less and less of them, and they're going to be an cuboidal epithelium. Lots of alveoli there. After we go from the respiratory bronchiole, we branch into the alveolar sac, yeah, alveolar ducts and alveolar sacs with each alveolus, as you can see here. Yeah, they are just spaces of very thin walls. Okay, and there is an important structure here called BALT, B-A-L-T, like M-A-L-T, but that's in the alimentary canal and the gastrointestinal system. It's called bronchial associated lymphoid tissue, like that one, mucus or mucosa associated lymphoid tissue. This one is bronchial because it's related to the bronchi. It's not a lymph node. Alveoli and interlobular septa. You remember when we said the interlobular septa, it separates between the functional units. Okay, the functional units are probably the bronchopulmonary the bronchopulmonary septums, the bronchopulmonary segments. Very important structure here. It has the pulmonary vein. You see how thin this is? This is the pulmonary vein, and this is taking the oxygenated blood into the heart. Okay, back into the heart. Okay, the pulmonary vein has a loose connective tissue around it when it's in the interlobular septa. So the interlobular septa composed of very loose connective tissue as well as the pulmonary veins, separating between segments of parenchyma, parenchymal units, whatever you want to call them. I think they're called bronchopulmonary units, segments. Alveoli. So this is an alveolus. This is the alveolar duct. As you can see, this is branching from the respiratory bronchioles. Yeah, so it's just a space. Okay, and the acinus is just a space again. And they are outlined by pneumocytes as well as endothelial cells and inhabited also by macrophages. This is a macrophage here. This is a capillary wall, yeah? And this is an endothelial cell. You see how close the red blood cells are to this space, which has more oxygen than this area and has less CO2 than this here. That's basically the function of the pneumocytes, having a very thin wall, and the endothelial cells also will have a thin wall here because these are capillaries here. And we cannot really distinguish between which one is which. Is it a pneumocyte? Is it an endothelial cell? Unless we do stains. So very important to remember the very thin structures in here. Okay, and because of formalin, we're able to keep these structures in their look as we basically put them to death. We cause some kind of preservation of the tissue. So pneumocytes, what do we have here? This is cytokeratin. This is pan-cytokeratin stain, and this delineates the epithelial cells. Basically, in here, it shows the pneumocytes, which have this cytoplasm in here, and very thinly giving those shapes around to give these spaces more of an more of a surface area. This probably is a surfactant cell, which is the type 2 pneumocyte instead of the type 1 pneumocyte here. Type 2 pneumocytes put the surfactant to keep the patency of the alveolus. This here is a macrophage, that's why it's not staining, and there are the endothelial cells that are not staining as well, and of course the red blood cells. Here we have another stain called the TTF stain, TTF1, thyroid transcription factor 1 stain. It's specifically targeting the nuclei. Yeah, the nuclei of what? The pneumocytes. Okay. Endothelial cells not staining, macrophages not staining, and that's it. There is much more than this, but I don't have the ability to give that much knowledge. And there you go. This is from Lindbergh, Normal Histology, Elsevier series. Okay. And I hope this was helpful.